Dentists are problem solvers, specifically when it comes to the partially edentulous or the edentulous patient, when it comes to trying to take care of their infection, their fractures, their failures, or their inability to function. I want to specifically talk about the changes that have taken place with an implant-supported denture, or as we all know it as a fixed hybrid removable denture. Fixed hybrid removable dentures have been very frustrating in the past because of the records and the ability for you to verify implant position. The advantage of the iMetric camera allows us to replace all of the verification analog impressions that we used to take trying to find out where exactly those implants should be and how they're oriented to each other. Combine that technology with the box scanner and our ability to work virtual with a lab remotely, it gives us the ability now to have unbelievable accuracy in our final product. When we are gathering our records for a fixed removable hybrid prosthesis, we really need to obviously have a 3D CT scan. We then combine that with joint vibration analysis to let us know what the disc, the condylar disc, is doing upon function. During our screening appointment, if we have a possible airway issue, we will also make sure to get a sleep study done on that patient to find out if we can affect the airway by the mandibular position when we are done with our prosthesis. At the records appointment, that's where we use the iTero camera that we have here, the intraoral camera that allows us to accurately record all the anatomical structures that we need. One of the most important things that we do when we are setting a patient up for this is to make sure that we're going to have success when we deliver the final bridge. As you all know, that's all done at the beginning. That's done with proper Facebook technique, proper records taking. Sometimes we have to really work on the occlusion before we do anything to resolve any kind of TMJ issues. You have to make sure that you can get confirmation of aesthetics so that you can deliver and have the patient sign off on what they're going to receive later. All that has to be done before the surgery or anything like that. And that's what makes the records such an important part and a vital part of this whole process being successful. Those of you that have done fixed removable procedures in the past, you know that one of the most frustrating parts of this can be the surgery. We really have to make sure that the implants are put in a very predictable position. And at the end of that surgery, that is when we get our records of the implant orientation. That's where the magic comes with this 3D technology. And it is phenomenal how accurate that scan is. Literally 2 days later, the final prosthesis arrives in our office. It is through the ability of communicating remotely with our lab that allows us to have that kind of technology that quickly. The patient's response to this kind of technology is just amazing. Some of the patients have been through the conventional way of doing these kind of bridges with all the verification jigs, all of the verification impressions, all of those steps. Their reaction to what is now possible is, it's fun. It's fun to watch that. Knowing that you've done the best thing possible for your patient always is very rewarding to a dentist. It is one of my favorite things in the world, is to see the smile on the patient's face when we deliver these final bridges. The steps and the technology to achieve a very, very predictable final result in an implant-supported bridge is frustrating, to say the least. I get that. I would love to go over any of these steps with you. I would love to help you in consultation with any of your patients. You just got to give me a call. I look forward to meeting you.